I've had an MRI before. I've never had one clinically. I've had them done as part of research. And I think, generally it's a very well tolerated procedure, and my own personal experience was the time went faster than you would expect. Many people actually fall asleep in the scanner if we're not asking them to actively do something. I am David Wolk. I am a professor of neurology and a cognitive neurologist at University of Pennsylvania. I direct the Alzheimer's Disease Research Center, which is our NIH-funded research center, and I am also co-director of the Penn Memory Center and the Penn Institute on Aging. An MRI is really just kind of a giant magnet that basically affects protons in the brain in such a way that one can measure different aspects of brain structure and function. In the context of patients who have memory or thinking disorders, we often get an MRI scan for a couple reasons. One is we get it to just make sure there's nothing surprising there, like a stroke or a tumor or something that could be explaining symptoms. Almost never that's the case, or we would have picked up on it sooner. And then other things we can measure with an MRI are whether or not there's evidence of vascular disease in the brain. And then in addition, we can look at brain structure and get a sense of whether there's any evidence of patterns of shrinkage in the brain that might suggest a particular diagnosis. So for example, Alzheimer's disease, we tend to see some degree of shrinkage in a part of the brain involved in memory called the hippocampus. MRIs are defined based to some extent on their magnet strength, so how strong of a magnet it is. And so most clinical MRIs are 1.5 or 3 Tesla magnets, which again is just a measure of the strength of the magnet. We do a lot of research using 3 Tesla MRI scans here as well, but also use a 7 Tesla MRI scan. And that stronger magnet just gives us better resolution to look at various aspects of brain structure and function. One of the amazing things about MRI is unlike a PET scan, like an amyloid PET scan, that might tell us one thing about the brain, really only, which is whether or not there's amyloid in the brain. MRI, again, can tell us about structure in the brain. Different pictures can tell us about structures deep in the brain versus structures on the surface of the brain. And so from a research perspective, we can start to learn what are the kinds of changes that are suggestive of the earliest signs of a condition, what are the kinds of changes that we can see that predict whether someone in the future might develop memory or thinking issues, and what are the kinds of things we can measure to see whether a treatment is effective, to see whether we're slowing down progression in the course of a condition like Alzheimer's. Technology has really played a big part in my research, but also just generally in the field of Alzheimer's disease. And probably one of the things our group is particularly known for has been the ability to measure very small areas of the brain that are the very earliest areas affected by Alzheimer's disease within the memory area of the brain called the medial temporal lobe. And so we've developed methods that allow us to detect changes in brain structure that occur before people have any symptoms of Alzheimer's disease.